typical Texas guy. I played baseball and football, rodeoed my whole life, and so I beat my body up pretty good. But what happened in 2008, I had a horse fall on me, and she basically, without me knowing it, broke my back, fractured my ankle. The pain was so bad in my ankle, that's where my attention was, and went a couple of years without even realizing that my spinal cord was being compressed. And so I lost all nerve function to my lower, from the knees down. Couldn't lift my toes, couldn't move my feet, couldn't feel anything. And every doctor was like, well, sorry, we can go fuse you here and here, and we can do a discectomy here and try to alleviate some of the pressure, but the nerve's been damaged for too long, you're SOL. So that was 2 years ago, and I could barely walk. I had to wear these orthotic prosthetic braces. They were full carbon fiber. They weighed about 2 pounds each, and you couldn't engage your calves. It kept your foot at a 90-degree angle. And now I can move my left foot. I don't wear those braces anymore. Was able to start working out again. No pain at all, really. So no neuropathy. That's a big one too. I mean, last time I was here, I had both shoulders done, every disc in the lumbar, my hip, right knee, and left ankle done. So I was in quite a bit of pain, but not anymore. Almost back to playing weight, but not quite there. And playing golf twice a week, which I would have never thought I'd be able to do again. Obviously, you guys have grown, right? There's a whole lot of staff, and everyone's always, I told my wife when we left last time, I said, probably the best medical staff I've ever been around, as far as just attentiveness, compassion, and it hasn't changed. It's improved even. I mean, you add that many more people treating you the same way, and you just feel better.
Okay, we're going to talk about Jeremy Walker. Jeremy is a patient we treated in the past, his lumbar spine. He has a lot of issues, some bulges, some discs that are pretty damaged, as well as the facets. 2 years after the application, what we can see is that the patient comes without pain. He accomplished all the objectives that it was to improve the strength on the muscles, improve the functionality of the back, as well as the mobility on his back. He now relates to us that he's improving every moment.
Going through the imaging is quite a bit different than the States. I mean, telling me exactly what they're seeing instead of just going, we saw this on film. Showing me where it's at, what that means, what the expected outcome of that is. It's just night and day compared to what, and I've had 14 surgeries, so I've seen plenty of orthopedics. It's been pretty amazing.